HIV is a virus that weakens the immune system by destroying important cells that fight disease and infection. It is transmitted through contact with certain infected body fluids. HIV infection is lifelong and, if left untreated, will typically progress to AIDS. No effective cure exists for HIV, but with proper medical care, HIV can be controlled and prevented. Dr. Mitchell Whitehead with Baptist Healthcare is an expert in HIV management. He's with us today to bring us up to date on HIV treatment and prevention. Thank you so much for coming on today.
Thank you. It's a pleasure to be here.
To get started, share a little bit about your experience at Baptist.
Sure. Well, I've been at Baptist about a year now, and I practice full-scope family medicine and primary care, in addition to being an HIV specialist.
So what exactly is HIV? We hear the acronym a lot, but what really is it?
Sure. So I know most people have probably heard about HIV, but it stands for the human immunodeficiency virus. HIV is a virus that infects your body's immune system and targets specific cells, the helper T cells, which we call CD4 cells. Once it destroys those, your body can turn from HIV into AIDS, or the acquired immunodeficiency syndrome, making it possible for your body to get all sorts of opportunistic infections that, if untreated, could lead to life-threatening illnesses or even death.
I'm curious how common it is in the general population, I guess, but I guess specifically in older adults. We don't really think about STDs among older adults, but they do exist.
This is very true. About 2 weeks ago, the CDC came out with a new bulletin telling us that actually sexually transmitted diseases are on the rise in America again, specifically things like gonorrhea, chlamydia, syphilis, and unfortunately HIV. Older adults seem to worry less about STDs because many of our older adults have already had vasectomies or hysterectomies, and they feel that protection is no longer necessary, and they feel like they're at low risk. But we are seeing, even in Florida, a higher rate of STD infections in our elderly population.
How is HIV specifically transmitted?
So there are only certain activities for which you can contract the HIV virus, most commonly with infected bodily fluids, blood, sexually fluids that are transmitted. You cannot get HIV through saliva, sharing a drink, eating a sandwich, or using the restroom after someone.
Okay. Now, who is at risk for HIV?
So we all know that certain members of our population are at risk for HIV, specifically the LGBT group, but we're also seeing a higher rate amongst heterosexuals with HIV rising in the community. Also, we know that people who inject drugs into their body are at higher risk, especially if they share needles.
Okay. Now, maybe I've partaken in some of those activities that you mentioned, and I'm worried that perhaps I contracted HIV. I imagine there's some beginning stage symptoms associated with it?
That's right, Josh. There are. A lot of people 2 to 4 weeks after the initial infection with the virus undergo what we call an acute retroviral syndrome phase, which is like a cold or flu. You may get chills, fevers, aches, and it feels just like you have the flu, but your flu is negative. You also may break out in a rash or have a sore throat. It's always best to tell your healthcare provider about these symptoms and to tell them about any potential exposure so we can test you and understand more what's going on.
And I guess it could be dangerous because, like you said, those are symptoms that are often associated with more benign illnesses, but it could be HIV.
Yes, that's very true, and often we're seeing that 1 in 7 people with the HIV virus don't actually know they have it because they assume things like this are just a cold or flu bug and don't get tested.
So once it's diagnosed, what does the treatment or care prognosis look like?
So we have made great strides in HIV treatment now. In the 80s or 90s, unfortunately, HIV always progressed to AIDS and most often ended in death. That is no longer the case. There are brand new therapies and treatments now where people can take 1 pill once a day and totally suppress the virus, making it undetectable. People with HIV now live normal lifespans, and as a physician, personally, I think it's easier to manage at times than diabetes or high blood pressure with multiple medicines. People typically come in to see their doctor every 3 to 4 months for blood work and get refills. But the HIV is very much a manageable condition now that no longer has to end in a death sentence.
It sounds like, just like with so many other diseases and ailments, the key is really early detection. Is that right?
That is very true. We know the sooner we start therapy, the better. The old days, we would wait until your immune system had weakened and then would start the drugs because the drugs were so toxic. Now with the newer drugs, we try to start as soon as we can to let your body's immune systems and natural defenses never go down the hill, so to speak.
I imagine there's a lot of misconceptions, a lot of rumors that have gotten passed around through the decades about HIV. Tell us about some of those misconceptions.
Yeah, so when HIV first hit in the 80s, people weren't even sure how it was transmitted. People were scared to use public restrooms. People were scared to kiss someone with HIV virus. We now know that the HIV virus, as we mentioned earlier, can only be transmitted through certain things. We also know that people who have the newer medicines and are becoming undetectable means they shouldn't be able to infect their partners or anyone else. So the newest idea is undetectable should mean untransmittable. So just because someone has HIV, it doesn't necessarily mean that they have to be treated, unfortunately, like they have the plague or some awful illness. People are now living normal, healthy lives with this manageable condition.
Sure. I'm curious. Anything with HIV, anything with AIDS, anything with sexually transmitted diseases tends to be taboo. People don't really like to talk about it. But like I said earlier, education, awareness is so important. Are there resources in the community people can go to learn more about it in a non-threatening environment?
Sure thing, Josh. There certainly are. The first conversation anyone should have is talk to their healthcare provider or their primary care doctor. This is something that could be a good conversation. Our latest screening guidelines are telling us that we should screen everyone for HIV and make it routine testing. That way we don't have to have special papers to be signed just to check for HIV. In the Pensacola community, we have some great local organizations where people can go for a free HIV test. These include the AIDS Healthcare Foundation here in Pensacola and the HIV Oasis Group in Pensacola as well. And anyone can go and see a counselor and have a HIV test done.
Fantastic. Great information. Thank you so much for coming on.
Thank you. It was a pleasure being here.
And thank you for watching. Until next time, enjoy life. You've earned it.